Today, we're talking about osteoarthritis. This is a problem that affects a huge number of people. And the reality is, modern medicine often doesn't really address the root cause. Instead, it mostly tries to manage it with medications. So let's break down what's actually going on. Osteoarthritis is essentially the degeneration of joint cartilage. That cartilage covers the ends of your bones and allows them to move smoothly against each other. When that cartilage starts to break down, mainly because it's not getting proper nutrition, that's when osteoarthritis develops. After that, you start seeing secondary changes, things like bone spurs and other structural issues. But here's the key point. Those are not the cause. They're a consequence. The real cause is the breakdown of cartilage due to poor nutrition. Think of it like this. If you feed a person well, they stay healthy and strong. If you stop feeding them, they gradually waste away. The same thing happens to your tissues, including cartilage. So the question is, why does cartilage stop getting what it needs? Well, cartilage is a unique type of tissue. Just like your intervertebral discs, it sits in areas of high pressure. And here's the interesting part. It doesn't have its own blood supply. Why? Because if it did, those tiny blood vessels would just get crushed under constant pressure. So how does it get nutrients? Think of a kitchen sponge. When you squeeze and release it, it absorbs water. But if you compress it and leave it like that, it dries out and becomes stiff. That's exactly what happens with your joints. When natural movement, that cycle of compression and release, is disrupted, the cartilage stops getting nourished. It dries out and starts to break down. Now here's the problem. A lot of people deal with joint pain for years, spend tons of money on treatments, but never actually address the root cause. You've probably heard people say, your joints are just wearing out. But that's an oversimplification, and honestly, it's misleading. Because if you believe your joints are worn out, it sounds like there's nothing you can do, except surgery. But that's not true. Your body is constantly regenerating. Your skin renews about every 28 days, your bones every several years, and cartilage can regenerate in about 3 to 6 months. But only under one condition. It has to get proper nutrition. Every living tissue in your body can heal. You cut your finger, it heals. You break a bone, it fuses back together. Cartilage is no different. It just needs the right conditions. And here's the key piece. It all comes down to joint alignment. If the bones in your joint are positioned correctly, the cartilage gets nourished. If not, it starts to break down. And what controls bone position? Your muscles. So the real solution is restoring proper muscle balance. If some muscles are too tight and others are weak, the joint mechanics get messed up, and the cartilage stops getting what it needs. And in that situation, no supplement is going to fix the problem. You can take all the chondroitin or other expensive products you want, but if nutrients aren't reaching the cartilage, nothing changes. Now let's get practical. One of the most common causes of knee osteoarthritis is tightness in the front of your thigh, your quadriceps. Here's a simple fix. Stand up and hold on to something for balance. Bend your knee and gently move your leg back, extending at the hip. You should feel a stretch in the front of your thigh. Hold that position for about 1 to 2 minutes. In many cases, people feel relief right away, sometimes even after the first time. So here's the bottom line. Osteoarthritis isn't a life sentence. It's a signal that your muscle balance and joint mechanics are off. And fixing it isn't just about pills. It's about movement, alignment, and proper function. The sooner you start, the better your results will be. Start today.